This year, Siteman Cancer Center will care for 75,000 unique patients. While we care for all these patients, we have been focused on what can we do differently and better. I'm Tim Eberlein, and I'm the director of Siteman Cancer Center. Actually, I'm the founding director. Fast forward now, 25 years later, after the official naming of Siteman Cancer Center by Al and Ruth Siteman, you now have a new ambulatory care cancer building, which we hope will consolidate all of the outpatient cancer services for Siteman Cancer Center.
It's time for us to make an even greater impact in the fight against cancer. And this building is the first step in an incredible new direction for us and those who come to us for help.
It's a 9-story, 658,000 square foot building. I think it's going to help double down on our second goal of providing the very best patient-centric and supportive care that we can possibly do. In fact, our vision is world-class cancer care, one patient at a time.
Cancer took my grandfather, my mother, 8 of her siblings, and several members of my family. And as a result of my family history, I'm at a higher risk for developing cancer at some point in my life. The Siteman Cancer Center is a building of hope. This building will welcome people when they're going through their most challenging times of their lives. They'll be scared for themselves. They'll be scared for their loved ones. And they'll come here and they will feel that hope.
It's all about the patients. And a few of our patients will lead us on a tour of this building.
I am Mary Shahid, and I am a prostate cancer survivor, a prostate cancer advocate, and the founder of the Empowerment Network that aids and supports families with prostate cancer. This beautiful building is a beacon of hope that will deliver the access and the victory for this disease.
So we have experts in every single kind of cancer, and those experts will be cohabitated so that we will reduce the number of appointments for patients. We will make it more convenient for patients rather than going to different floors and different buildings. The experts come to the patients rather than the patients going to each of the experts as we currently do. This cohabitation will also facilitate placing patients on therapeutic clinical trials. And we get patients from all 50 states in the United States. So as you might imagine, a lot of the patients who come to Siteman Cancer Center have never even been to St. Louis, let alone to our medical center. And I hope patients will recognize we listened to them when we were designing the building. We've designed the building so that there's lots of natural light, and there's 433 garage parking places. There's places for them to do business. There's food service in the building. Most of the patients, probably 80% of them, will never leave one floor. So they will be able to see their experts on one side of the floor. They'll be able to get blood work. They'll be able to get their chemo or immunotherapy infusions all on the same floor. I think that'll be a paradigm shift. What would make it more convenient, what would make it provide more support, and ultimately what would provide more hope and more cures for those patients.